Hello, I and my colleague will be talking about combination treatment using treatment of hypertension. And there is no how we could go into this broad topic without designating some of these branches of this hypertension, like the rationale, the mechanism of action, what hypertension actually entails, some of the um, rationale that governs our combination therapy, and the dosage comparison between these drugs. Hypertension, as we all know, is the persistent elevation of the arterial blood pressure above 140 over 90 millimeter mercury at age of 18 and above. Some of the drugs used in treatment of hypertension include the diuretics. Example, we have the loop diuretics that comprise of the furosemide, potassium spiral, spironolactone. Other classes include the vasodilators. Example, the hydrolazine, ACEI, angiotensin converting inhibitors like sinoprene. Other classes are numerous examples, the ARB and so many others used in treatment of this hypertension. I'll be giving the floor to my colleagues who will be taking us on the mechanism of action and equally the rationale why we choose these various combination therapy in treatment of hypertensive patients.
The mechanism of action, I'm going to be talking about the ACEI inhibitor, which is angiotensin converting enzyme inhibitors. So what it does is that it blocks the conversion of angiotensin 1 to angiotensin 2, which is the potent vasoconstrictor, thereby reducing the aldosterone secretion and reducing blood pressure. Then for the calcium channel blocker, they can block the calcium influx into the smooth muscular stress, leading to muscular contractility and reduced peripheral resistance. And as a result of this, there is a reduction in blood pressure and without having effect on the heart rate and cardiac contractility.
Up from where my colleague left off, the next combination therapy we are going to talk about is the angiotensin receptor blockers and the diuretics. Under this combination therapy, we have two examples, the Jotam Plus and the Telsat HCP. ARBs generally act by inhibiting the actions of angiotensin 2, on its receptors. And these angiotensin 2 receptors cause vasoconstriction. So when they inhibit them, it leads to vasodilation and reduced blood pressure. The second, diuretics, generally acts by increasing the excretion of sodium and water from the body through different actions on the kidney, thereby reducing cardiac output and heart rate. The second class we talk about is the beta blockers and the diuretics. Under this class, we have an example, Medicard, and the beta blockers generally act by suppressing the action of adrenaline and other stress hormones, thereby leading to reduced heart rate and reduced blood pressure in general.
I will be taking on the rationale, and the first one I will be taking is calcium channel blockers plus angiotensin converting enzyme inhibitor. And in this particular combination now, we try to target reduction of proteinuria because both of them can cause less proteinuria. Then when it comes to the calcium channel blockers in that combination, it can induce less pedal edema. And that is the rationale for combining both of them. We move to the next one, which is angiotensin receptor blocker and the diuretics. This particular combination now, the angiotensin receptor blocker there will help to prevent the narrowing hormone that narrow blood vessel, while the diuretics will help to reduce fluid and the salt retention. We move to the third one, which is beta blocker and diuretics. The combination is being called Medicard. This particular combination now, the beta blocker there, as we all know, normally cause fluid retention and the sodium retention. The diuretics also, due to the mild volume, it normally causes mild volume reduction. It will not increase renin secretion by the kidney. So what both of them normally do there is that the beta blocker will help to blunt the renin secretion by the kidney, while the diuretics will help to excrete the sodium and the fluid retention, salt retention being caused by the beta blocker. We move to the triple combination, which is the combination between calcium channel blockers, angiotensin receptor blocker and diuretics. This particular combination is being called Tensipane. What we try to achieve in this particular combination is to enhance efficacy, improve outcome, increase patient adherence, and also to target multiple mechanisms of actions. and by then achieving a good therapeutic goal at the end of the process.
Now, our choice of combination in all this is combination of the ARB, the CCB, and the diuretics. This is our preferred choice of combination on some notes that like efficacy, the side effect profile, the cost, and adherence. Talking about efficacy, these three different classes of drugs target different target sites. Like the ARBs target the hormonal regulation, the CCB, the vascular tone, while the diuretics target the fluid and electrolyte balance. Now, talking about comorbidities, in diabetes, ARB is preferred due to their nephroprotective effect and CCBs because they do not adversely affect glucose metabolism. Then we are talking about cost. Fixed dose combinations are cost effective and patients are likely to adhere to combinations that are cost effective. Now, talking about adherence and compliance, when you're talking about dosing frequency, it's easier for patients to take a once daily pill than having multiple doses. Now, talking about side effect profile, these combinations have a favorable side effect profile. The ARBs are preferred when you are trying to overcome the ACEI cough side effect, while in peripheral edema, some CCBs cause peripheral edema. That is where the diuretics come in to mitigate this.
Some clinical guidance have recorded this our preferred choice of combinations as an effective treatment regimen. My colleague will take over from here.
I'm going to be comparing the dosage, the efficacy, and then the cost of the different medications. You know, first, there are different combinations of hypertensive drugs. There are double medications, there are double dose therapies, and then there are triple dose therapies. There are also 4 combinations, depending on how severe the cases are. We have the ARBs and the hydroperoxide, we have the CCBs and the ACIs, we have the CCB, ACI, and then diuretic combination. All depends, and we also have to consider the side effects. Just like we know that the ACEIs, one of the side effects is severe cough, which can be treated with off-label hyoscine and antitussive medication. But then in the ARB, they have the temosatan, the valsartan, and then the beta blockers. We have the atenolol, propranolol. Those are very effective in myocardial infarction and heart failure because they help in in the case of myocardial infarction, there is inhibition of blood oxygen flow between the vessel to the heart. And in the case of beta blockers, we already know that they are very effective. They are very effective in treatment of myocardial infarction and heart failure. So, in a nutshell, when it comes to the choice of medication, we actually have to consider first the cost because different brands have different cost range. So if you're going for a branded product, it's likely to be more expensive than the unbranded. So the choice of medication depends solely on the pharmacist or the doctor prescriber and also the patient's finance. But at the end of the day, the whole point of treatment is to the end that the patient becomes better and gets a better result than when he or she wants it to be health facility.
Before we round things up, I think there is a need for us to specify those that will be beneficiary of each and single combination here. With the number 1 being calcium channel blockers. If it comes to pregnancy, a monotherapy is an ideal one. But if there is any need to combine with another drug, you will now go for low combination thiazide with calcium channel blocker can be beneficiary for a pregnancy woman. But when it comes to elderly patients, maybe there is an issue with kidney, renal failure, or relating to it, it is better to combine ARB plus diuretics. It can be more beneficiary to the person. When we are looking at arterial filtration, we now go for beta blockers plus diuretics. When it comes to combination, for somebody that is suffering from diabetes and the person is elderly, it will be ideal to go for ARB, angiotensin receptor blocker, plus diuretics. For no reason, the combination between calcium channel blocker and the beta blocker is not ideal and they will never stand because it will cause total heart block. Thank you.